The gunshot echoes. You look down. Blood spreading fast across your shirt. Dark red. Getting bigger. The pain hits. Sharp. Burning. Overwhelming. You're alone. No hospitals. No ambulances. No doctors. The world ended months ago, and you just got shot. You have maybe 20 minutes before shock sets in. Maybe an hour before you bleed out. No one is coming to save you. Your survival depends entirely on what you do in the next 60 seconds. Will you panic? Will you make the fatal mistakes that kill most gunshot victims? Or will you stay calm and do what needs to be done? Because I'm about to tell you something most people don't know. Most people who die from gunshot wounds don't die from the bullet. They die from what they do after. The panic, the wrong choices, the fatal mistakes. And in a world without hospitals, those mistakes kill faster. 3 months after society collapsed, a man named Marcus was scavenging in an abandoned store. He heard footsteps, saw movement, raised his weapon. Too slow. The other person fired first. Marcus took around to the abdomen. Left side he had a medical kit. He had supplies. He had knowledge. But he made one critical mistake in the first minute. He died 30 minutes later. Alone, surrounded by everything he needed to survive. Want to know what killed him? Not the bullet. His choice. One single wrong decision. And here's the terrifying part. Most people would make the exact same mistake. Would you think about this? Civilization is gone. No electricity. No running water. No emergency services. You're in your shelter. Or scavenging. Or defending your territory. Someone fires. You feel the impact. The burning. You look down and see blood. What do you do? Because the next 5 minutes will determine if you live or die. And I'm going to show you 3 things people do that guarantee death. Then I'll show you the only method that gives you a chance. A real chance. But only if you can stay calm while your life is draining away. Can you do that? Can you think clearly while bleeding? Let's find out. You've been shot. Abdomen, left side. The pain is incredible. You can't think straight. Your hands are shaking. Blood is soaking through your clothes. Your first instinct, stop the bleeding, pack the wound, apply pressure. That's what you've heard. That's what makes sense. So you grab cloth, bandages, whatever you can find. You stuff it into the wound, deep, hard. You press down, trying to stop the blood. You just killed yourself. You don't know it yet, but you're dead. Here's what you don't understand. Not all bleeding is the same. Not all wounds should be packed. Abdominal wounds. Packing them is often fatal. Let me explain why. Your abdomen contains organs, liver, spleen, intestines, kidneys, all critical, all delicate. When a bullet passes through, it doesn't just make a hole. It creates a pressure wave cavitation. The tissue around the wound path is damaged, bruised, bleeding internally. When you pack that wound hard, when you push cloth deep inside, you're doing 2 things. First, you're potentially pushing bacteria and debris deeper into your abdominal cavity. That causes peritonitis, infection, death in days. Second, you're putting pressure on damaged organs that are already bleeding internally. You might stop external bleeding, but you're making internal bleeding worse. Marcus did this. He packed his wound, pressed hard. The external bleeding slowed. He thought he was winning, but inside, his spleen was lacerated. The pressure he applied pushed blood into his abdominal cavity. His belly started swelling, getting hard, rigid. He couldn't understand why. The wound was packed. The bleeding seemed controlled, but he was bleeding internally. Liters of blood pooling in his abdomen. His blood pressure dropped. His hands went cold. His vision started to blur. He tried to drink water. His body was going into shock, hemorrhagic shock. His organs were shutting down from lack of blood. He collapsed after 20 minutes unconscious, dead in 30. All because he packed an abdominal wound like it was an arm or leg wound. He applied pressure like he'd been taught. But abdomen wounds are different. They require different treatment. Treatment he didn't know about. So packing kills you. What else could you do? The bullet hit you. You're bleeding. You remember something about tourniquets. Those work, right? Stop blood flow. Save lives. You've seen it in movies. Military uses them. So you grab a belt, rope, anything you can tie. You wrap it around your torso, above the wound. You pull tight. Tighter, you're going to cut off blood flow to the area. Stop the bleeding. You just made it worse. Much worse. Tourniquets work on limbs, arms, legs. Places where you can cut off blood flow without killing the person. You can stop blood to an arm for hours if needed. The arm might suffer damage, might not work properly after, but the person lives. Your torso, your abdomen, you can't tourniquet that. You can't cut off blood flow to your internal organs. Your liver needs blood. Your kidneys need blood. Your intestines need blood. Cut that off and they die. And when organs die, you die. Painful, slow, certain death. But there's another problem. When you wrap something tight around your torso over an abdominal wound, you increase internal pressure. You're compressing everything inside. Any bleeding vessel gets squeezed, but it doesn't stop bleeding. It bleeds faster into the cavity. It's like squeezing a bag full of water with a hole in it. The water doesn't stop. It just comes out faster from a different place. Plus, you're restricting your breathing. Your diaphragm can't move properly. Your lungs can't expand fully. You're already in shock. Your body needs oxygen. Now you're suffocating yourself, making shock worse, accelerating your death. I watched this happen, not to me, to someone else. After the collapse, a woman named Sarah, shot in the lower abdomen. She wrapped a belt around her torso, pulled it as tight as she could. She thought she was being smart, proactive, taking control. Her face went pale in minutes. She couldn't breathe properly, started gasping, panicking. She loosened the belt. Blood poured out. She tightened it again. Wouldn't breathe. Loosened it. More blood. She was trapped in a cycle. Each time she tightened it, she caused more internal damage. Each time she loosened it, she lost more blood. She lasted 45 minutes, conscious for most of it, knowing she was dying, unable to stop it. So you can't pack it, you can't tourniquet it. What's left? How do you stop the bleeding? You remember something about cauterizing wounds, burning them closed. You've seen it in movies. Heat a knife, press it to the wound, seal it shut. No more bleeding. Simple, effective, right? You heat a knife over a flame, get it glowing red. You press it against the wound. The smell hits you, burning flesh. Your flesh. The pain is beyond anything you've experienced. Worse than the gunshot. You scream, but you hold it there, because this will save you. This will seal the wound. It won't. You just created a new problem. Cauterization doesn't work like in movies. In reality, when you burn tissue, you create dead tissue. Necrotic tissue. It doesn't seal anything. Blood vessels deeper in the wound are still bleeding. You've just covered them with a layer of dead burnt skin. That dead tissue becomes infected always. You've essentially created a perfect environment for bacteria. Dead tissue, deep wound, no blood flow to bring white blood cells. Infection sets in within days. In a world without antibiotics, that infection will kill you. Slowly, painfully, fever, delirium, septic shock, death. But there's a more immediate problem. The pain from cauterization causes more shock. Your body is already stressed from blood loss. Now you're inflicting massive pain. Your blood pressure drops further. Your heart races faster. You might pass out from the pain alone. And if you pass out while treating yourself, you can't finish treatment. You die from the original wound while unconscious. There's also the risk of burning too deep, damaging organs underneath. That heated knife doesn't know when to stop. Press too hard, hold too long, and you burn through to something vital. Intestine blood vessel, making the injury catastrophically worse. In the first month after collapse, I saw 3 people try cauterization. Not one survived. The best lasted for days. Infection took him. The worst passed out from pain during the process. Never woke up. Bled out while unconscious, so you can't pack it, can't tourniquet it, can't burn it closed. How do you survive a bullet wound when there are no hospitals? Is it even possible? Or is a bullet to the torso just a death sentence in the new world? Here's the truth. Most abdominal gunshot wounds are fatal without surgery. With surgery, survival rate is about 70%. Without surgery, less than 10%. Those are brutal odds. But 10% means some people survive. How they do what I'm about to tell you. Every single step, in the right order, without panic. It's not complicated, but it requires discipline, calmness, and accepting that you might die anyway. Can you do that? Can you stay calm and methodical while bleeding internally? You've been shot, abdomen, left side. Here's what you do. First, sit down. Not lie down. Sit, lean back slightly. This position minimizes internal bleeding. Lying flat increases pressure on the wound. Sitting reduces it. Second, assess the wound. Look at it. Is there an exit wound? Did the bullet go through? If there's an entry and exit wound, that's actually better. Means the bullet isn't inside causing ongoing damage. If there's only entry, the bullet is still in there. Different problem, but same initial treatment. Third, cover the wound. Not pack it. Cover it. Use clean cloth if you have it. Doesn't have to be sterile, just not filthy. Lay it gently over the wound. Don't push it in. Don't apply hard pressure. Just cover it. This keeps bacteria out. That's the goal. Fourth, tape it in place. Medical tape if you have it. Duct tape if you don't. Create a seal. You're making an occlusive dressing. This prevents air from getting in if the bullet penetrated into the chest cavity. Prevents pneumothorax, collapsed lung. Another way to die. Fifth, and this is critical, manage shock. You're going into shock whether you want to or not. Blood loss causes it, but you can slow it. How? Stay warm. Use blankets. Keep your core temperature up. Drink water if you can. Small sips. If you vomit, stop drinking. But hydration helps maintain blood pressure. Sixth, stay still. Don't move unless you have to. Every movement increases internal bleeding. Your body is trying to clot, trying to seal damaged vessels. Movement disrupts that. Sit, stay calm. Let your body do its work. Seventh, monitor yourself. Watch for signs you're getting worse. Increasing abdominal pain, rigid belly, severe swelling, dizziness, confusion, cold extremities. If these get worse, you're bleeding internally and there's nothing you can do. Make peace with it. This method doesn't guarantee survival, not even close, but it gives you the best chance without surgery. You're protecting the wound, minimizing ongoing damage, managing shock, and hoping your body can compensate for the blood loss and internal injuries. Marcus didn't know this. He packed his wound, caused more damage, died unnecessarily. Sarah didn't know this. She tourniqueted her torso, suffocated and bled simultaneously, died in agony. The 3 people who cauterized, they died from infection or pain-induced shock. But I knew someone who survived. A man named David, shot in the abdomen, right side. He sat down, covered the wound gently, taped it, stayed still for 3 days. 3 days of pain, uncertainty, fear. But he didn't panic, didn't do anything stupid. On day 4, the pain started lessening. Day 7, he was moving around. Day 14, he was functional. The bullet had missed major organs. His body had managed to compensate. He survived, not because he got lucky, because he didn't make the fatal mistakes. He gave his body a chance to save itself. Now let me tell you about the different types of wounds, because where you're shot matters a lot. Chest wound, different treatment. You need to seal it immediately, completely. Both sides if there's an exit wound. Chest wounds suck air, collapse your lung. That kills fast. Seal it. Tape all 4 sides. Make it airtight. Then sit upright. Never lie flat with a chest wound. You'll drown in your own blood. Limb wound, easier. Apply pressure, direct hard pressure. If it won't stop, then tourniquet above the wound, as tight as you can. Note the time. You have maybe 4 hours before permanent damage, but in a survival situation, losing a limb is better than losing your life. Head wound, not much you can do. If the bullet penetrated the skull, you're probably dead. If it just grazed you, treat it like any other wound. Pressure, covering, but expect massive blood loss. Scalp wounds bleed heavily. It looks worse than it is. Usually neck wound. Critical, life-threatening. You have major arteries in your airway there. Cover it. Apply gentle pressure. If you apply too much pressure, you might cut off blood to your brain. If you apply too little, you bleed out. It's a balance. And honestly, most neck wounds are fatal without immediate professional care. But back to abdominal wounds, because that's what most people will face. Center mass. That's where people aim. That's where they hit. And that's where survival is hardest. Here's something else you need to know. What you do in the first hour matters. But what you do in the days after matters too. You survive the initial wound. Bleeding is controlled. You're in shock but stable. Now what? Infection is coming. It's inevitable. The bullet carried bacteria deep into your body. Your intestine might be perforated, leaking contents into your abdomen. You have days before infection kills you. What do? Antibiotics if you have them. Take them, strong ones. Broad spectrum. If you don't have antibiotics, you're relying on your immune system. Keep the wound clean. Change dressing daily. Watch for signs of infection. Red streaking pus, increasing pain, fever. If you see these, you're in trouble. Eat if you can. Your body needs energy to heal. But if you have abdominal pain, if eating makes it worse, stop. Perforated intestine means food is leaking into your abdomen, making infection worse. In that case, you're already dying. Eating just speeds it up. Rest. This is critical. Your body is in crisis mode. Every resource is going toward survival. Don't waste energy on unnecessary movement. Sleep as much as possible. Let your body heal. And here's the hard truth. Even if you do everything right, you might still die. The bullet might have hit something critical, nicked an artery, shredded your liver, perforated your bowel in multiple places. In those cases, without surgery, death is certain, just slower, but you won't know immediately. You'll have hours, maybe days, and in those hours you have a choice: panic, suffer, die in fear, or accept it, make peace, die with dignity. That's the final survival skill, knowing when to let go. So let me ask you this, right now, today. Are you prepared? Do you have medical supplies, bandages, tape, antibiotics, pain medication? Do you know where they are? Can you access them if you're injured? Do you have a plan, a safe place to recover, someone who can help? Or are you alone? Because being alone when you're shot is the worst scenario. You can't treat yourself properly, can't stay conscious if you go into deep shock, can't defend yourself if someone else comes. Have you practiced? Have you actually covered a wound, taped a dressing, if it felt what it's like to work with shaking hands? Because in the moment, when you're actually shot, everything will be harder: pain, fear, blood. These things make simple tasks impossible if you haven't trained. And have you made peace with mortality? Because in a world without hospitals, a gunshot might be your end, no matter what you do. Can you accept that? Can you stay calm anyway? That mental preparation might be the most important survival skill of all. You've spent 10 minutes learning this. You know what kills people: packing abdominal wounds, tourniqueting the torso, cauterizing, and you know what gives you a chance: gentle covering, staying still, managing shock, letting your body heal. But will you remember this when it matters? When you're bleeding, when shock is setting in, when every instinct is screaming at you to do something? Will you have the discipline to do it right? Or will panic take over? That woman in that store, that man in the shelter, The 3 people who burned their wounds, they all had the same knowledge available. They all could have survived, but they panicked, made mistakes, died. Don't be them. Don't let fear kill you. Don't let ignorance kill you. To be the person who sits down, that covers the wound, stays calm, that gives themselves a chance. Because in the world that exists now, medical care isn't coming, help isn't coming. It's just you, your knowledge, your discipline, your will to survive. And sometimes, that has to be enough. This is deadly scenario, where preparation today determines survival tomorrow. Where knowing the difference between life and death might save your life. Share this with people who need to know, people who might face this, people who deserve a chance, and subscribe, because next time we're covering another post-collapse scenario, another situation where one choice means death and another means survival, another skill you'll need to stay alive in a world that's trying to kill you. Stay sharp, stay ready, stay alive.